All right. Welcome to Dr. Jeff's first Facebook Live, the psychological benefits of plant medicine. I'm really excited to do this because, I'm down here at Rythmia in Costa Rica. This country is awesome. The people here are so cool, and this is a beautiful country. It's safe, it's clean. The Costa Rican gente, the people are just the most amazing people I've ever met in my life. They're just loving, wonderful people. So I'm so stoked to be down here at Rythmia Life Advancement Center. And I'm the little background on me quickly. I'm the Chief Medical Officer. And the reason they call me Dr. Jeff is because I have a doctorate in psychology. And I also have a master's in public health from UCLA. And, I've been working in so many different healthcare environments for probably the last 25, 26 years. And I've been working with individuals and groups, and I've been working in hospital settings, and I've been the administrative director of a really well-known rehab in Malibu. And I've worked at so many different facilities, all clinical settings. I've been doing research on healthcare and prenatal diagnostic screening procedures at the Neuropsychiatric Institute at UCLA. I've just been involved in everything health related. And it's such an honor to be down here at Rythmia doing this kind of work, because finally I was able to see a modality of treatment that is really, really effective. And of course, based on the topic of this discussion, that's plant medicine. So I'm going to get a little bit into that. Nowadays in society, especially in the US and the Western world, Canada and other parts of the world, a lot of the issues that people are facing, we're dealing with huge numbers of depression and tons of anxiety disorders, panic attacks, bipolar, ADHD. There's so much addiction. It's just things are out of control. People in the Western world are actually pretty unhappy, and there's a lot of reasons for that. But what I want to talk about is sort of the Western model for how to treat those types of situations. If somebody has any of these disorders, that I've listed, if they end up going to a psychologist or a psychiatrist or any sort of treatment facility or any sort of doctor, what usually happens is they're immediately given a bunch of medication. Now, again, a Western mindset is I need a quick fix. I need something to quickly alleviate my symptoms. We treat symptoms in the West, and I need to feel better real fast. So what happens is so many people are overprescribed medication. We have the antidepressants, the SSRIs, we have the methamphetamines like Adderall and Dexedrine and Vyvanse, and there's just keep in mind, there's some people obviously that benefit greatly from these medications, but most people who are prescribed these meds are not. It's not necessary for them, and they're not given the tools on how to overcome their issues that they're facing. Addiction is a big one, and a lot of the detox protocols for safety, physical safety, involve medication. So people that have alcohol addiction, they're given Ativan, they're given Neurontin, they're given other meds to help them taper off the alcohol. And then they're usually put on antidepressants and other meds to help them sort of stay positive, right? And so these are all sort of Band-Aids that our society has gotten so used to. And the overprescription rates for meds for depression, anxiety, addiction, bipolar is just through the roof, especially ADHD. These meds are dangerous, and they have a lot of side effects that are problematic. So, it's something to think about. And, it's a quick Google search to, type in meds prescribed for depression, for example. You'll see the numbers. It's astronomical in the United States and in Canada and in Europe. It's just out of control. There's so many meds being prescribed. Another interesting thing about having some of these situations emotionally in the West is that it takes a really long time to work through them in the Western framework. So going to a therapist for sometimes years, seeing a psychiatrist for every month for 5 years, 10 years, going in and out of rehabs. The average stay for a lot of people in drug and alcohol rehab when they have an addiction is 6 to 12 times. So imagine going to rehab 6 to 12 times. It's expensive. It's super problematic. There's a lot of, it's a business. Medicine in the West is a business. And I'm not knocking that because that's the way that society is set up in a capitalistic sort of economy. But it's important that the individual take responsibility for their own health and what's going on for themselves within the system. That's a big, big deal. If you turn over your health to a corporate structure, chances are you're not going to get what you need out of that system because, first of all, they're not really involved in your care, and they're following what's called evidence-based practices, which can have some efficacy depending on the situation, but it's not very personal, and it throws you into a group of people systematically that does not actually cure or resolve the things you're dealing with. So there's a lot of liability involved for healthcare practitioners, and there's a lot of issues that go on that are corporate based. So what I want to do is explain how you can take control of your own health and how you can use plant medicine and other modalities that are out there that are holistic to really overcome the things that you're facing in your life. So let me tell you a little bit about rehab. I'm an expert on rehab. I ran for 8 years, one of the most famous rehabs in the world in Malibu. I also did a couple of internships when I was a doctoral student at various rehabs in Los Angeles. Rehabs are places to go to dry out from your drugs or alcohol. Rehabs are really difficult to, after you leave them, to have success. And the nationwide statistic in the United States is that 12 to 15% of people who do a 30-day inpatient stay actually stay sober. So we're looking at about 85% of the people or more who go to rehab for 30 days do not stay sober after being there. They measure it after a year. So if you're looking at all the economic costs, you're looking at getting out of work and getting out of school and going to rehab, it's just the benefits do not outweigh the costs. And so that's why people go back over and over and over again. And they're always in these environments where there's a lot of clinicians, and these clinicians have good intentions, and the psychologists and the marriage and family therapists and the doctors, they're often, they're really trying to help these clients. But the problem is that those clinicians don't have the tools to really help these people overcome addiction, overcome the underlying depression, overcome the anxiety. And so basically everybody just gets frustrated. And working and managing a team of clinicians for many years, when I would do counseling with these staff, they would just be like so frustrated. Just be like, I don't know what to do. All my guests are relapsing. All my patients are coming back for treatment. I don't know what's going on. And everybody's frustrated. Everybody's frustrated. The patients are frustrated. Their families are upset. The clinicians are upset. And in the meantime, there's just like meds being prescribed and ongoing therapy, and it's just like a revolving door of clinical practice that's just happening. And the people who need the care and need the help are just getting trapped. And they feel hopeless and helpless, and there's suicidal plans and thoughts, and there's attempts, there's overdose. And again, I talk about addiction because that's an extreme sort of life or death situation. Depression and anxiety also can lead to those same sort of behaviors. There's a lot of addiction, a lot of dual diagnosis going on with people that have depression and anxiety. There's suicidal attempts. So these issues are really serious. This stuff is not like, we don't have a million years to work with somebody who's struggling with these issues. So the duration of therapy in the Western framework is really long. And, I used to tell my patients that I worked with individually, I used to say, I don't have 5 years to work with you. I have about 6 months, if that. And maybe it's 3 and maybe it's 1. So we really need to get to the core issues of what you're dealing with. And we need to work on this and get you some tools and some skills. But the problem was I was constrained by the system I was in Los Angeles. As working as a clinician, I didn't have the ability to refer people to plant medicine facilities. I didn't have, Plant medicine was not something that was understood by the guests or the patients or by clinicians. There's not a lot of knowledge about it. So I was constantly frustrated. I would see patients over again with the same issues just coming back and back to my office. And it was, it's just frustrating. And I know a lot of practitioners feel the same way, and they really want to help their patients, and they're struggling themselves to figure out what to do. And the patients are just like spinning like in a hamster wheel, just over and over again. So another interesting thing with doing therapy is that you have to build trust with the clinician. So if somebody has trauma and they have a history of abuse, victimization, let's say it's from childhood, they do not trust the clinician. They don't trust anybody. They don't trust themselves. They're in a state of mind where they're in fear, and their guard is way up. They have a big wall around them, and it's really hard to trust people. And to ask somebody who has trauma, especially from childhood, to lower their guard and connect with a clinician and trust that clinician, it can take years to do that. I remember working with a patient who it took 2.5 years for that patient to actually begin to trust me and feel that I was on their side to help them work through their issues. Now, 2.5 years is way too long, in my opinion. That is just ridiculous. It's like, why do we feel in the West that therapy needs to be something that is drawn out, that is long, that takes years to do, 18 months or more, couple years if, depending on the situation. Why has that become the standard that that's just what it takes? Because, people think, logically, well, hey, if I got 15 years of being in a victimizing state in my family or in my job or whatever, I'm going to need at least a couple 5 to 10 years to kind of get out of that. Now, I'm challenging that assumption. I do not believe that doing therapy and working on trauma and processing all the things that have gone on in your life need to take years and years to do. I've worked with the most acute, severe patients that exist: acute psychiatric addiction, trauma, and women and children that have been victimized. Those are my patient populations that I've worked with for years. I don't have 10 years with them. I have maybe a couple months. Not to mention the fact that therapy is expensive. And all these treatments that they're getting often are not covered by insurance. It's out of pocket. And everybody is struggling just to make ends meet, let alone go see their therapist, right, for talk therapy for once a week. It's just not realistic. So what happens in the Western model is that there's all these external sources of change that are expected of the client. So go to a sober living, get new friends, go to therapy, get a new job, go back to school, change the way you deal with people in your environment. Now, those things are important. Those things are important. I agree that that's a good way to do stuff. However, if the internal environment of the person has not shifted or changed, those external changes are not going to last. That is a temporary Band-Aid to help somebody maybe get through a moment. But if I'm miserable, if I am dysfunctional with the way I think and behave, if I'm upset with myself and I have trauma and I have fear and I'm worried about myself and the world, I am not going to have success in my life. So internal change is the key to overcoming depression, anxiety, and all these issues, and addiction and just general malaise and just not being happy in life. Internal change is the key. So the question is, how does internal change occur? How can you do that? If you're just not aware of all these ways in the world that exist to do a shift internally, you're kind of like hanging out to lunch. There's nothing on your plate that you can use. You're confused. You're trusting people that you hope have your best interests at heart, and a lot of them do, but a lot of them are just in it for the money and to get a paycheck. And they don't really have the skills to actually help you with your internal shift. That's what I love about plant medicine. Plant medicine is deeply personal. Plant medicine is something that is very individual. It's your own experience. It's about your own shift. It has nothing to do with anybody outside of your own consciousness. And what happens with the plant medicine experience is there's a lot of neurochemical changes that go on that are really beneficial. There's emotional, psychological, there's spiritual shifts that can occur. And as the chief medical officer down here at Rythmia, I like to study and look at all the neurochemical sides of this, because being the science guy that I am, I find that just really interesting. So the example I give for, let's say, trauma, if I'm 5 years old and I get scared by a dog, and a dog bites me at age 5, what happens in my amygdala, which is my part of my brain where my subconscious memories and my subconscious thoughts are stored, what happens is a neuron pathway gets established where it represents dogs equal fear. And that gets burned into my brain and ingrained into a pathway that anytime I see dogs after that, I'm afraid. And that's a sort of an evolutionary sort of fight or flight response. It's for survival. Of course, if I'm a caveman and I'm getting chased by a saber-toothed tiger, I want to know that that's a scary thing to stay safe, right? So what happens is there's that same biological mechanism that we have today in modern society, where if a dog scares me at age 5 and bites me, I associate dogs with fear. So now I'm 48 years old and I'm afraid of dogs. And I'm a little bit confused because no dogs are biting me and everybody else around me likes dogs. Dogs try to come up and say hi to me and I'm afraid, right? And I'm kind of confused at myself, and I just chalk it up to, well, I just don't like dogs. But I feel a little bit weird because I see that everybody else does, so something's going on. So what happens is when you take plant medicine, the amygdala part of the brain gets to link up with the prefrontal cortex part of the brain. And that's where our conscious memories, our awarenesses are, our conscious thought processes are going on. And my conscious awareness in my prefrontal cortex gets to link up with my amygdala and say, wait a minute. You were afraid of dogs at age 5 for a very good reason, because one bit you and it was scary. And that was important for you to run away and get away and not get hurt more. But because that was at age 5, that's not relevant now. You're not 5. You're 48 years old. You're able to navigate dogs. You want to have a good experience with dogs. And so now you can build a neuron pathway that represents love and happiness and excitement for dogs, and care and nurturing for dogs, and trust for dogs. And so what happens then with the studies that have been done on plant medicine is it shows that there's a neuron shift in the brain that now resolves the trauma and the fear associated with that dog, and it builds a new pathway and it says, look, dogs are cool. So that's an analogy and just a little silly example about how that can work with relationships. If I was abused by my dad, which I wasn't, but if I was, I would have no trust for men. I would have no trust for adults. I would not trust people. I would be bad in relationships. I would have a horrible sort of vibe about me where I wouldn't want to get close to anybody. And I would be sad and I'd be lonely and I'd be confused because everybody else is having relationships and everybody else has, partners that they're connected with and everything's cool. And so I do plant medicine. I see, oh, wait a minute. When I was a kid, my dad was abusive, as an example, and I was scared and I was hurt and I was worried and I was basically terrified. And that was about then. It's not about now. And now people in my life are loving and they're nice, and I can see who's not, and I can make that decision. I'm an adult, and now a new neuron pathway gets set up where I realize that every single person in the world is not my dad, and I can build a new structure neurochemically that helps me move past my fears of relationships. So that kind of situation is what's occurring with plant medicine. And guess how long? One night. And some people 2 or 3 nights, but most people 1 night, and they've resolved it. And so, when I first learned about plant medicine, I did it myself. Before I did it, I was like, no way, man. I've been told for 18 years of university training and grad school and all the best facilities and hospital care, I've been told that it takes years. I've been told that, the best you can hope for is just managing some symptoms. And the best you can hope for is that people just don't kill themselves or don't overdose. And so just try to contain people and maybe hopefully cross your fingers, they'll get better. I was in a system like that in grad school that was just absurd. I actually never believed it. I just didn't know how to challenge it at the time. And so now at Rythmia, I'm seeing with all these people who come here, and it's incredible. I get to meet so many people. I interview and talk to every single guest who comes here. And these are the most amazing people that come. They all have something they're working on. Like I said before, anxiety, depression, ADHD, addiction. They're going through a life shift. They're getting a divorce. They're unsure of a divorce. They don't feel they have a purpose in life. They have an empty nest syndrome. They have a ton of meds that they had to get off of to come do this plant medicine, and they're addicted to what, who knows. And so these people that I work with have the most amazing experience. And guess how long? Yeah, it's not 2 years, it's not 5 years, it's 1 week. 1 week. And if you don't believe that, and I don't blame you because it's hard to believe, check out the testimonials we have on our website. Talk to people that have come here. I'm telling you, I left the Western medical world to come down here 3 years ago and work at this facility because it is actually creating change for people that's incredible to watch. And I promise you that if you come here and check this out, you will not be disappointed. You will have the most amazing experience of your life. This is some of the most miraculous experiences I've had as a clinician. And I invite you to come down here to Costa Rica, this beautiful facility we have. We're having a lot of fun. I believe in having fun. I believe in enjoying yourself. We have the best chef, Meg, who's cooking the organic, vegan, just incredible food. The Costa Rican staff here, seriously, I can't say enough about them. Pura vida, they are amazing. So I invite you to come to Rythmia Life Advancement Center. Check us out on the website, rythmia.com. I look forward to meeting you. And if you've been here before, I look forward to seeing you again for a retune-up. Thanks, you guys. Pura vida.